Hi, everyone. Thank you so much for joining. I guess I'll just get started here since we're at 3 o'clock. Welcome to all of MHA's affiliates. We're really excited to bring you an affiliate-only Hill Day this year, which is our first time targeting affiliates and setting up meetings for you all in many years. I am your host and moderator today, Caren Howard, and I'm the Director of Policy and Advocacy at Mental Health America. I'm really excited to be joined by you today, as well as Mary Giliberti, our Chief Public Policy Officer at Mental Health America, and our two guest speakers, Erik Fatimi of Cornerstone Government Affairs and Christopher Kush of Soapbox. All of who have contributed to making Hill Day such a great success. I'm very honored to be part of the reason you all will have a successful Hill Day. And we say that it's already a success because you're here and you've agreed to take the meetings with your congressional leaders. Please give yourself a pat on the back and know that MHA national staff and leadership really appreciate you taking time out of your day on top of your regular responsibilities to make your voice heard at the federal level. We have a lot to cover in our short 1 hour together here. So we'll get started. We have an additional 30 minutes added at the end for questions, coaching, and practice time. That time is completely optional and up to you whether or not you want to stay, but staff will be on to help facilitate any questions that you might have. And we'll start with our screening mapping data. We'll go over the objectives and goals of this meeting. We'll provide an explanation of the appropriations process and then identify MHA's FY23 funding asks for SAMHSA and CDC, and then spend time in groups by state to strategize and practice Wednesday's meeting flow. Today's objectives to get you prepared for Wednesday's meetings are: number one, you should know what our asks are at the end of this meeting. Number two, you should know what it takes to have a successful meeting, including being concise. And number three, you should have a plan for the meeting speaking order and practice it with others in your state team. And for those who may not have another state team, there are a couple of staff openings if you would like for MHA national staffer to join you in your meetings. Just let us know. Let's go to the screening data slide, Sid. So as you all are probably very well aware, MHA's screening data program was elevated to the next level by our Center for Innovation this year. At the end of February, they released a map of all of the data by state and county. Most screeners voluntarily give de-identified demographic data. Over 70% of screeners identify as female. It's a younger help-seeking population, with 42% being ages 11 to 17 years old, and 73% under 24 years old. Over the last 2 years, we've seen over 2 million screens taken, and many increases in different racial ethnic groups, especially in Asian and Pacific Islander screeners taking screens, or people who are listing other as race or ethnicity. In 2020, over 2.5 million people took a screen, and as you can see, this was a much larger number, and in fact encompassed more than like the previous 2.5 years of screenings. The projected monthly averages so far show that there will likely be 3 million screens taken by the end of 2022. And that would be, again, just an increase in a help-seeking population looking for information about what they're experiencing. Next slide. The percentage of people screening at risk increased as well. We saw percentages across all demographics increase and severity as well. Over 200% of the number of people who completed a screening in younger age groups were screening more severe than before 2020, so in 2019. Even though the screening program has grown and more people are screening, we also know that there's been that kind of increased distress, which these numbers show. Next slide. In March and April of 2021, which is kind of the line at the top that's a lot shorter than the rest of the lines, where we see increased suicidal ideation. 42% of individuals who took a depression screen reported experiencing thoughts of self-harm or suicide, more than half or nearly every day in the last 2 weeks, which was 11% higher than the average rate of suicidal ideation in 2019. We also see increases by race and ethnicity, where you see the kind of line, the reddish line at the bottom indicating white non-Hispanic screeners, and then the highest screens being taken in, or the highest people identifying as having thoughts of self-harm or suicide occurred in Native American and Indigenous populations, as well as in Black or African American populations. And NIH data recently came out that that really mirrors this and parallels MHA screening data. Next slide. The proportion continues to grow of people experiencing suicidal ideation in 2022. However, the reasons for such distress differ by race, and we found that Black or African American screeners are citing financial concerns. Native Americans and Indigenous people are identifying trauma or past trauma. Latinx and Hispanic screeners are more worried about COVID-19, and we know there are more multi-generational families due to cultural living arrangements that live together, and oftentimes you see a wide range of ages in one household, which certainly affects the level of worry of transmission of COVID. And then we also see loneliness and isolation at really high rates in Hispanic and Latinx communities. Grief and loss being highest in Native American and Indigenous communities. Next slide. We saw the largest increases in parent youth, as well as PTSD, anxiety, and substance use screens. Over 9% increase in people scoring at risk when they took the parent screen in 2020 versus in 2019. And these numbers continue to increase through 2021 and 2022. Next slide, Sid. And so I'll kind of leave you with the importance of incorporating both data and your own lived experience and stories in your meetings with Congress. So we know that lived experience with mental health conditions make people experts in their own experience. And Congress needs to hear that. Crafting and sharing a story is really an important tool to educating lawmakers and the legislative offices, whether you're meeting with the member or their staff. They need to hear that background story along with the data points and the statistics. So with a combination of both your story or your colleague's story or the stories of the communities that you're serving and what you're seeing in the data that you've been given about your state or district, from Maddie and Teresa at our Center of Innovation. By putting those together, you should be well on your way to having a successful legislative meeting. I would like to now introduce Erik Fatimi of Cornerstone Government Affairs, who will share a bit about the back end of the appropriations process and how to make sure that you're ready to get your asks fulfilled by your member.
Thanks, Caren, and hi, everyone. Yes, my name is Erik Fatimi, and I'm with Cornerstone Government Affairs. I spent 12 years as a Senate staffer, and during that time, I participated in hundreds, maybe thousands of meetings like the one you're about to do this week on the other side of the desk. And so I know, what makes a good meeting. And so since that time, I've been help groups like MHA, folks like you, talk about strategies and prepare for the meetings that you're going to have. I always find that it's useful to know, all right, you're talking to staffers or members on the Hill. Where are they right now in the process? What are they thinking about? Why are we talking to them, this week? So when all three of the asks that you're going to be hearing about, we're going to go into more detail in a minute, they all have to do with appropriations. So all federal spending. And the Congress appropriates money by fiscal year. The next fiscal year is fiscal year 2023, and it starts on October 1. So it doesn't line up with a calendar year, but it starts October 1 of this year and runs through September 30th of the following year. Now, but Congress is thinking about it now. They are supposed to start the process of writing the bills for what they'll spend in FY23. They're starting that process right now. So throughout March, hundreds of groups like MHA are, we would normally say, descending on Capitol Hill, except we're all doing it virtually. But this is the season when groups are meeting with their members or the staffers that represent the members, and they're making their case. Put a priority on such and such. So they're coming with, mental health, education, healthcare, childcare, transportation, you name it. This is the season for it. And what will happen then is these staffers and members will do multiple meetings in the same day throughout March and even into early April. And at a certain point, they will collect among themselves in the office, and they will identify what are the priorities that we're going to put our muscle behind, and what is going to go on our list of the things that we want to prioritize for this upcoming appropriations bill, FY23. And what they will do is they will narrow that list out of the ones that they've had all these meetings with, and they will submit their priorities to what's called a database, an appropriations request database. So this database is run by the Appropriations Committee in the House or Senate. These are the committees that actually write the bills. And so each member, as I said, will submit the things that they care about most into the database. We want to be on that list. So the goal here is just, we want to convince the staffer or the member that the causes that we're bringing are important enough that they should support them being in their appropriations requests. Let's go to the next slide. So what's the best ways to do that? And Caren has already actually talked about a couple of them. But I would start with one of them, which is, don't feel intimidated. They want to hear from you. It's their jobs to hear from you, and they want to hear from you. You know what is happening in the districts and states better than they do. You are the expert. And if they want to be a good member or a good staffer, it's their job to know what's going on in the district or state. And they are used to doing these kinds of meetings. They're used to doing them, online now by video. They're comfortable with that, and no one is expecting you to be the most polished lobbyist of all time. And that's not what they're looking for. They're looking for people who care, people who are informed, people who know what they're talking about, and have specific asks to bring them. So, as Caren said, it's good to know the statistics, and it's important that there be the factual basis for why the mental health situation in this country right now is in such a crisis, why there is urgency. But we also need to explain to them anecdotally what you're seeing in your district or state. You could even use a person as an example, or yourself as an example of what you have seen. We all know that the mental health crisis was really urgent before COVID. It's gotten worse since. You could talk about that. Now, when my next point here is being precise in your asks. And what I mean by that is, we're going to go through the 3 asks in a moment. Make sure you really understand them. The one, I would say, potential area where I would say look out for, where a meeting is most likely to be unsuccessful, is when the person who's bringing the ask doesn't understand them. You're going to hear about them in a second. Don't worry, you don't know where they are yet. But if this is an opportunity to understand what the asks are, and if you don't, here's your chance to ask the questions. There will be a question and answer period. There's chat and so forth. Make sure you understand the questions and be precise in how you're asking for them. One advantage to them being on video is that you can even have notes off to the side or print out what the asks are. You don't want to look like you're reading from it, like it's all a script and you're being robotic about it, but it's okay. You can have notes off to the side if you need a little bit of a hint to get it exactly right. Next point is allowing space for questions. And you might even pause here and there. Any questions about what I've talked about so far? The best kinds of meetings are when they turn into conversations. Now, not every staffer is a home run. You're going to find some that just kind of hear you and just say thanks. We run into those sometimes. Don't take it personally. But the best meetings are when you actually engage and they want to talk about it. Now, one thing that can happen sometimes in these meetings, especially with something like mental health, which everyone can relate to in one way or another, is that sometimes the conversation can go down tangents that are not part of our asks. That would not be surprising if that happens. What I would encourage you to do is bring the conversation back to the 3 asks. And there's what you can do is, if something goes in a completely different direction, say, I'd like to talk to you more about that, maybe at a different time. Today, we're really hoping to focus on these asks. Don't blow them off and take them up on their offer to talk about it later, but make sure that we really keep the focus on these 3 asks. And here's why I say that. Of course, the mental health, there's lots of different things that people in the mental health community can be asking for. And MHA will do that and lend its support to lots of different things. But we picked the 3 asks that we're going to talk about because, honestly, if we don't ask for them, nobody will. And that is why it's important for us to we've picked these 3 because we think these are really the ones we want them to walk away with, that MHA has a special responsibility to ask for these particular ones. So this is our moment to meet with these offices and ask for these asks. And then last, of course, say thank you for their time, and just be courteous, as you will be. I don't even have to tell you that. But I'm confident that these meetings will go well. Again, they want to hear from you. I'll stop there.
Thanks so much, Erik. I will go ahead and remove the pin, I think. And sorry, I'm getting a little tripped up here, but it seems like you can see the screen, so that's what's most important. So now that we've heard from Erik about the purpose of this specific asks and how important it is for us to stay on topic, I want to transition over to what we're asking for. So here is where you can learn a little bit more about the block grant that we're referencing today. The Community Mental Health Services Block Grant was created a couple of decades ago. And we know that there's currently a youth mental health crisis that shows significantly worse impact of COVID on young people than on adults. And we also know that the block grant and other sources of mental health funding have been historically underfunded. That the substance abuse block grant has a set aside. We know that there's different programs throughout SAMHSA and a couple in CDC that kind of track data or otherwise surveil youth mental health. However, there's no coordinated federal response from a public health perspective to ensure that the nation's mental health is addressed appropriately. And so with COVID really manifesting and demonstrating a lot of the fragments and issues with the mental health delivery system that you all are already aware of, and with Congress taking seriously, holding hearings and highlighting the issues in the mental health system, we think that this is the really perfect opportunity for our three asks. The first ask being funding SAMHSA. Oh, sorry, let me go back a little bit. Yes, Sid, sorry, there's one more slide I forgot about. So let's just go over really quickly, Sid, that next slide, which talks about just why it's important and what we can do in our meetings. Next slide. So we did get some increased funding during COVID. However, that was one time. Some of you all received some of that funding, which is excellent. But we would like to see more sustained funding. The reason we chose the Community Mental Health Services Block Grant is because it's the largest flexible source of money for mental health in the states. And it's distributed to community behavioral organizations, such as MHA affiliates who are doing kind of downstream work later on for people with SMI and SED. However, we do know that prevention activities are effective, and there's not a lot of that happening. It's not really being reimbursed by insurance providers. There aren't many grants for prevention that are long-term. And we know that the Community Mental Health Services Block Grant is a designated amount of discretionary funding that will go to the states every single fiscal year. So we're targeting that as our piece of the pie that we need increased. So currently with FY22, the number is not where we would want, and we're asking for 1.5 billion. So our first ask, next slide, is for $1.5 billion in funding for FY23 for the Community Mental Health Services Block Grant. The second ask, Mary will go into, the second and third ask, Mary Giliberti will go into a little bit more specifically. So just so you know, it's a 20, we're asking for a 20% set aside of funding for prevention activities in the mental health block grant. And we're also asking for a new coordinating center at the CDC for adolescent mental health, and we'd like that funded at 25 million. Next slide. For our first ask, the Community Mental Health Services Block Grant, again, largest pot of funding for mental health at the federal level. It's funded every year. It typically goes to states for use with, for services for people with serious mental illness and for youth with serious emotional disturbances. We've heard from affiliates that that funding restricts their activities. It does not contribute to any prevention activities that could be carried out. And so affiliates have to go find other funding sources that may or may not be sustainable to help with their screenings and other community focused events for people before crisis and before a serious and persistent mental illness diagnosis is made. Some of the prevention activities that we think will come under this block grant, in addition to screening, is like kind of helping with some of the early psychosis and first episode psychosis things that, or issues that come up and there's no dedicated funding for. We also think that we'll be able to kind of pick up on some of the issues that youth and young adults have faced earlier on versus waiting, of course, until stage 4. So that's why we picked the block grant, and we're asking for almost double at $1.5 billion. Please remember that number, 1.5. And I'll now turn it over to Mary to explain asks number 2 and 3.
Great. Thank you, Caren. Sid, next slide. Okay, so I'm going to talk to you about the next 2 slides, 2 asks, which I know MHAers will really understand because we all really favor upstream approaches, right? As MHA, we don't want to wait till people are in crisis. And the mental health block grant is a really important source of funding. That's why we picked it. But it has this restriction where it can only be used for people who are, as Caren said, serious emotional disturbance for children and serious mental illness for adults. So what does that mean? You have all seen in your communities people that are not yet diagnosed, right? Especially with the pandemic, we've seen so many people coming forward, and we want to screen, we want to do integrated care, but that affects people who are SED and SMI and some people who are not. So we want to see a set aside. What's a set aside? It's when Congress says a piece of this money can be used for this purpose. So it allows the states and local communities, when the money comes down to you all, to use the money more flexibly to serve people across the continuum and get upstream instead of waiting for people to get into crisis. Now you might be saying, Mary, why'd you pick 20%? Well, the substance use block grant. So remember, even though we don't necessarily separate these things, in the block grant, they are separate. We have a mental health block grant and we have a substance use block grant. Well, in the substance use block grant, they already understand prevention and early intervention, and they have that 20% already set aside. We're just asking for the same thing in the mental health block grant, right? So we already have it in substance use. Now we want to have it in the mental health block grant as well, because we all know that mental health requires early intervention and prevention just as much as substance use does. In fact, sometimes it can prevent substance use later on if you get that mental health treatment early. So that's why our request is for 20% of the block grant to be set aside for prevention and early intervention activities. And as Caren was mentioning, this is particularly important for children because we know how many of these conditions onset early, and we also know what a lag time there is before someone gets that diagnosis, and especially a diagnosis of SED, which, as we all know, is very uncommon. There are lots and lots of children that need help that don't meet that definition. And while we're on the topic of children, I'll go on to the next ask, which is for a new adolescent mental health coordinating center at the CDC, the Center for Disease Control and Prevention, CDC. Now, with the pandemic, we've all heard about CDC, right? They are the ones that are responsible for public health. And again, as we think about public health has to be mental health and physical health. We at MHA really get this, right? We know that we want to see a population health approach to mental health, just like we have that approach to physical health. And we've seen this increase for youth in terms of, Caren went through the data, it just skyrocketed, right? Like the pandemic threw fuel on that previous fire that we had burning. And in your fact sheets, you can see some of the data that Caren was talking about. I mean, depression doubled, suicide was up even before the pandemic. The pandemic happens, and then we've got it even more so, right? And the Surgeon General's issued an advisory. The American Pediatrics Association and others have declared a national emergency. So, and you've seen it in your own community. So you can talk about what you've seen happen with youth in your communities and how important it is to have that upstream approach and how much we want CDC to go ahead and coordinate its activities and come up with a national strategy. So Erik was telling you every year we get bills, right? So in 2022, Congress had what's called an explanatory statement. That's pretty much what it sounds like. It means that they write something that says to the agency, here's what we want you to do, here's what we want you to know. And in 2022, in the explanatory statement, they talked about CDC kind of coordinating, I'll read it to you, establishing a program that leverages existing CDC activities dedicated to adolescent mental health to develop and implement national goals and a national strategy to improve adolescent mental well-being and advance equity. And it goes on. But there was no resources attached to that. It was just a statement that CDC ought to do these things. This is an important issue. So what we're coming back and we're saying, okay, now we want that to happen and we want some funding to go with it. So we're asking for $25 million for this adolescent mental health coordinating center at the CDC. So that's $25 million that we want them to include in their appropriations asks for the CDC to do these activities. And we have listed in your fact sheet some of the activities, and I just mentioned some of them: having a strategic plan, national goals, coordinating the CDC's work in this area, coordinating with other federal agencies, collecting and integrating data. And again, this is all on your fact sheet, so no need to memorize it. But what they're going to want to hear from you is what's going on with children in your area, why you think prevention and CDC involvement is really important to get upstream. And I think every MHA affiliate can talk about how we want to see a more upstream approach and what we've seen with children, and that public health has to include mental health. And so we want CDC to be working in this area to promote well-being for adolescents. Before we get into crisis, before we have these bad results, we want to see more of an upstream approach. So we're seeking this $25 million to implement this vision for adolescent mental health and well-being. Back to you, Caren.
Thanks, Mary. So we have about 1 minute before our next speaker is supposed to come on. So I'll try to do this as quickly as possible. But next slide, Sid. The most effective way to ensure your meeting goes well is just to plan it. So as you get together with the other people in your state team, all of you should have received your preliminary schedules via email, as well as a link to join the practice session in Zoom. Just ask each other who has a preference for doing what, who wants to kick off the introductions. You obviously talk about whatever city or locality you're from within the state and who you represent, where all of the consumers are that you're serving or that you're reaching out to. And then talk about who will discuss what's happening back at home generally. How has COVID impacted your communities, especially when it comes to those who are not yet diagnosed or who do not have a diagnosis of SMI or SED? How are young people faring? What are you hearing from parents? If you received a screening report from our Center for Innovation team, Maddie or Teresa, what does that report say specifically in your state? Or if you go to the mapping data website that breaks it down by state and county, what are those numbers saying? And what stories do you have to go along with that? And then who's going to make the 3 strong asks with a pause at the end for emphasis? Just like that. I think you can do it 2 ways. You can either designate one person to talk about each of the 3 asks, or you can assign one ask to a different person, or you can say 2 people will give their stories, and then a 3rd person will then make 2 of the asks, and then a 4th person might make the 4th ask. So as long as you guys plan out what makes the most sense for you in terms of where your strengths are in your speaking and your experience in the district or state and with the stories that you have, just determine that in advance. And we have 48 hours or at least a day and a half before all of that has to be figured out. And then finally, who will close and reiterate the need for elected officials to support local organizations back home? I think what's most important in my experience, working on the Hill, is that whenever there's a constituent in the room, you have to do what they want you to do. It's like the customer's always right. So know that as the affiliate who is employing people in their district, who is serving people in their district, and who's also an expert on lived experience, know that you have a right to not only this meeting, but for the member to follow up and submit their ask to the Appropriations Committee. And that list of their asks should include your ask of them, because you are a part of the district that they've been elected to represent. You can also determine that there is a different way to break up the speaker roles, and I kind of talked about the 3 different ways to do that. So again, amongst yourselves, just decide what works best and then practice that. I'm going to turn it over now to Christopher Kush from Soapbox. He's an awesome long-term advocate and helped us with scheduling your meetings. So lots of kudos to Christopher for helping us get over 60 meetings scheduled with members and their staff. We will turn it over to Chris now.
Thank you so much, Caren, and thank you to Mary and Erik as well. So this is part of your team that fights for you all year round through a long and complicated process. But I want to salute everybody who is going to be doing meetings on Wednesday, because signaling geography that something impacts the district is, of course, one of the strongest arguments you can make to get an office to support you. So very important work that we are about to do. I'm going to cover our logistics. Next slide. Next slide. Okay, we have a map of the United States. We have 49 folks from 23 different states. We are doing all of these meetings on Wednesday. There might be a couple of exceptions. They should all be webinar meetings. The way webinars work is we'll do almost all of them, and then some of them maybe they need to be rescheduled because the offices fall behind. The good news is you have a live help desk that's going to help you through this process. If you haven't done it before, it's just important to keep in mind that flexibility is key and that meetings can and do change on Capitol Hill. But it should be pretty stable at this point what your schedule looks like. You see red dots and blue dots on this map. I'm sure you know what those correspond with. Remember, and if you haven't done this before, When we talk about legislation, when we talk about federal funding, we cannot talk about politics. That is, we cannot talk about candidates. We can't talk about upcoming elections. We can't talk about contributions to candidates. And our strategy requires that we warmly and sincerely ask everybody who represents you, the places where you employ people, the places where you serve constituents, the places where you save lives. Our strategy requires that we warmly and sincerely ask the people who are currently representing us to help. So we're going to ask if you discover you have a House member or a senator that belongs to a party that you did not and would not vote for, we're going to ask you just not to bring that up. That sound like a deal? Great. It actually is important when we talk about legislation that we not bring up any of that stuff. Next slide. Let's go one more. I'm going to make sure in terms of the tips, everything that I wrote down to keep in mind has already been covered. In the virtual world, we're in Zoom now, so this is where the great majority of your meetings will be. Of course, the trick is always to manage noise, outside noise. So make sure you get all of your little loved ones out of the room if you can. Make sure you're inside if you can do that. I want to let everybody know that in 0 cases, so that is 0, did we get clearance to either videotape or audio tape any part of these meetings. So that is not okay to film with your screen or with your cell phone to tape any audio or video from these meetings. However, at the end of the meeting, you might ask for a screenshot that is a still photo, and that can be charming, and most folks will agree to that. Doing anything in terms of video and audio, though, would be a serious breach of what we agreed to. Final thing, something will happen in the virtual world to some of these meetings, which is that the staff and members end up getting a little bit later to all their meetings as the day goes on. So Wednesday, you will be in a meeting with maybe your meeting partner, and you're going to have that feeling. Are we in the right place? Is the member or staff on the way? So if you have that feeling, we're going to ask that you give them 10 minutes to kind of catch up. And then one person call the Soapbox help desk while the other person or people remain in the room. And that's because Soapbox can try and chase down the staff or the member. And if you're all there, we can get that meeting done. If we can just be a little more patient, even though it feels very strange when you're in that space and waiting for somebody to show up. Okay, so I think those are all my tips. Let's go to the next slide. I'm going to go through logistics. Before I do, something to think about before we start going through logistics. You will be meeting with a variety of members of Congress, senators and representatives, and their staff. If you have not done this before, you remember that I started out by talking about a long and complicated process. So we will not end our work on these issues Wednesday. They will not be settled Wednesday. And even if we won on every single one of them next year, we'd ask you to come right back and start it all over again for funding for the next year to help the next group of people that needs your services. So the process goes on. And I want you to think about, especially if you haven't done this before, if you're going to be calling again later this year about these issues, if you're going to be writing again later this year about these issues, if you're going to be following these issues and need some information about where are things now, who is the person who's going to pick up the phone in these offices? Is it the senator? Who is the person that's going to answer your email and say, you know what, it's interesting, most of that bill got attached to another bill, and take the time to give you information about the inside baseball? Who is the person who does that? It's staff. A staff meeting is a huge strategic opportunity for us. So when you meet with staff, you do want to get their email, but you also want to be respectful. You want to be optimistic about their ability to help us. You want to bond. So staff is critically important to us moving the ball forward. Okay, enough of that. By now, you all should have received a code via email for the Soapbox mobile tool. The Soapbox mobile tool is where you will find your schedule and links to the rooms where you will have your virtual meetings. The Soapbox mobile tool is not an app. It is only a website. It works on any browser. We recommend you use it on your desktop or laptop so you have the biggest screen real estate possible. There is nothing to download for the Soapbox mobile tool. Don't go to iTunes, don't go to Google Play. It's just a code that you put into a website once, and then it will remember and show you your schedule. The reason why we use it is because the meeting times can and do change, and there are a number of offices that schedule at the last minute. So if you've already looked at your schedule, you may have seen some TBAs. We need to use the mobile tool to keep you in the loop if things move around a little bit on or before the day of the event. If you did not get your Soapbox mobile tool, if you did not see that email in your main mailbox, and if you have a good firewall, if you didn't see it in your spam filter, you can send an email to Silwal, SILWAL, @soapboxconsulting.com now, so that we can email you your code so you're ready for the practice sessions in just a few minutes. So if you didn't get that mobile tool code or you don't see it, you can send an email to Silwal, SILWAL, @soapboxconsulting.com. Okay, next slide. When you go to the sboxmobile.com website, you put in your code. You just have to do that once, and your device will remember that code. We will ask you for your cell phone number, even though you can use the mobile tool on your desktop or laptop. We'll ask for that cell phone number because on the day of the event, on Wednesday, we'll send you a push notification if anything changes. We will send you a reminder 1 hour before each meeting because we are in different time zones. So we're going to actively work to keep us all on schedule on Wednesday. Before that time, there may be some changes. You just have to go to the SBox mobile website to see the latest related to your schedule. Next slide. The first time you log in, there's this little tutorial you have to get past, and then you see the main landing screen. The main landing screen has your 3 most important buttons along the top. They are all green. There's a button that says your schedule, a button that says your team, and a button that says documents. At the bottom, there is a red square that says Soapbox Help Desk. If you're on your cell phone, it'll call us automatically, but it'll show you the phone number if you're on your desktop or laptop, 202-362-5910. There are living human beings waiting to help you, both this afternoon and also Wednesday on the day of the event. Please call as your first strategy if you are having any trouble. So time is of the essence with these meetings, getting your stories into these appropriators. So if you are having trouble connecting, you need some help, you lose track of your group, it's all good. But please call us. Do not email somebody who has to then email us. We may miss our opportunity. Along the top, the documents icon has copies of your issue briefs. Your issue briefs are being sent to Capitol Hill directly tomorrow. So everyone you are meeting with will have an email with the issue briefs. It doesn't mean they're all going to read them, but many will read them. Some will say things like, I haven't seen it. I don't think I got it. It might be buried in their email box. It's okay. You can let Soapbox know on the feedback form that we have to resend the issue briefs. So you have copies of the issue briefs, and the legislative office has copy of the issue briefs. Some good news. Under documents, you will also find Caren's guides to what you should be preparing this afternoon during this practice session, and also some additional tips on getting ready for your legislative meetings. Okay, next slide. The icon that says your team will give you the names and the emails of everybody who shares your exact same schedule. If you are on a team, you will likely see both of your senators, your representative, and the other representatives of participants from your state. The rosters for these meetings are exactly what you see. So every office, even if it's not your representative, is expecting to see the team of people who are lobbying together. So that is your team. Good news. You're going to meet your team this afternoon if your team members are also on this briefing. But you can get in touch with them tomorrow if you want to reach out and ask some questions or do some additional preparation before the event by using the email. If you meet this afternoon and want to share your cell phone numbers, that's fine with us if it's fine with you. Next slide. This is what the schedule slide looks like. So, or what the schedule looks like on the mobile tool. So when you press schedule, you will see your meetings in time order. They are all listed in Eastern time. So if you're Central, Mountain, or Pacific, you'll have to do a little adjustment. And now you see why we're going to send you a reminder 1 hour before each and every meeting. The meetings will all have a link. It will in almost all cases be a Zoom link. Soapbox will open the link. Soapbox will monitor the meetings here in Washington, D.C. So you just have to press that link to enter the room. If you look closely, you'll notice that many of you have the same link in the same room you go to over and over again. There is a phone number and a PIN provided. That is a backup. So you should not have to use the phone number and PIN unless for some reason your video is no longer working on your computer. Again, before you get to the phone number, you'd probably call the Soapbox help desk. At the top of your schedule is the link you will use for your practice this afternoon. So that is where you can meet the rest of your team and you can work your way through the questions that Caren gave us about the 3 asks. So that link is under the schedule icon in the orange box at the top of your schedule. It is important, if you haven't done this before, that you understand that these are business meetings scheduled for you with your name to discuss the issues we were just briefed on. These are not town hall meetings. Other people are not invited to ask different questions or to discuss other issues. When we're in the virtual world, offices can be a little off-put or a little concerned if they see additional people in a meeting and they're not sure who they are or if they're there to discuss the same issues. So do not share the links with anybody. These aren't open office hours. The second thing is, if there's somebody who supports our issues, they still shouldn't be a surprise to these offices. So if there is somebody that you feel would be great to add to these meetings, you're going to contact Caren about pitching that person as somebody who should join the delegation. Okay, next slide. Every single meeting has a feedback form. You press the feedback icon. We know who you are and what meeting you're talking about. So it's real easy. Answer questions about each of the 3 topics. Were you able to discuss the 3 topics? What did the office say? It is not, the feedback is not just if somebody changes their mind or makes a firm commitment. This is for your team that's going to continue the conversation. So if you give some details about every meeting, they can pick up the conversation where you leave it without having to go back and recover everything. So please, a couple comments about each meeting. At the bottom, there's a little camera. You can attach a screen photo. Again, ask for permission if you take a screenshot at the end of your meeting. Okay, next slide. Zoom, next slide. We've all used Zoom by now, yes? I think so. So if you haven't, you will be asked, in the case of Zoom, to download an app just once. I bet all of your computers have already done this. So next slide. We're on Zoom now. So just to remember, there's just a couple things you can do. It's real simple. Bottom left corner is for audio and video. If your audio and video don't work, you can call the help desk, but frequently it's because you have another video conference software open so that your camera can only work with one at a time. So it's usually a good idea to not just close a window, let's say of Microsoft Teams or something, but you have to actually quit that other program. In the middle of the bar at the bottom, there is a chat function. You can see chat along the right-hand side of your screen and also the names of everybody in the meeting. I want to caution you about chat. So as staff or members join these meeting rooms, they can see everything in chat. So a good rule of thumb, try not to be funny in chat. Try not to be pessimistic or cynical in chat because somebody from the Hill might see it. Along the top, there are the few configurations you have in terms of video, how much you see, and that is basically it. Next slide. Okay, for the practice sessions, next slide, I'm going to remind you what we're going to do. So first off, if you didn't get your code or don't see it, remember, send an email to sillwall@soapboxconsulting.com. We'll send you that code again. You're going to go to sboxmobile.com and put in the code that we email you. You're going to give us your cell phone if you hadn't, get past the tutorial if you hadn't, press schedule, and look for that bright orange box at the top of your schedule. You're going to go to that link and you'll be able to see anybody else from your state team who is on this briefing. If nobody is there, you'll see the names of the other folks you've been teamed with under the team icon. And then you at least know you can get to the main room, you know it all works, and you can think about how you'd like to structure your stories, but you don't have to go through that alone. So if you get to the link and nobody shows up, we get it. You can either call it a day or come back here if you have additional questions. If you do see some other folks from your state, this is a great time. Who's going to introduce us? Who has a story about working with adolescents? Who has a story about what we got and versus what we needed in terms of funding and the service delivery in the district? So this is a good time to do that. And we will just leave you in the rooms as much or as little time as you'd like for that. If you have any trouble with any of this today and also Wednesday, the phone number is 202-362-5910. Somebody has asked about TBAs. So there are offices that schedule at the last minute. It does happen. So if you have a TBA, we expect to get a meeting time. We're still working on it. They have not declined, but they haven't found a time slot yet. So Soapbox continues to work and will continue to work tomorrow. Keep that mobile tool close so you can see updates. All right. It's an honor to have Soapbox have the opportunity to serve you, who serves people in our districts. And, you know, by the time they get to you, I think you needed to have been doing your work to make sure the funding is there, to make sure the networks are there. I mean, you're there so long before the people who need you discover that you're there. So you're really kind of, you are lifesavers and you're kind of angels. So we appreciate the opportunity to set up these meetings and to have you be part of the active dialogue on Capitol Hill around what our priorities need to be now. So thank you for that. I think my slides are done. I want to ask Caren if there's anything else I need to cover before we start moving into our practice rooms.
I think that's it. We had one question about people who might need to miss afternoon meetings because of previously scheduled appointments. So
thank you for mentioning.
That's the only one.
Yes, and thank you for mentioning that. I should have gone over that. So it's an election year. If an office says yes to you, they may have said no to somebody else. So very important that when we ask for meetings, we show up. So we want to be the group whose rosters matches participants. If you're not able to participate or you get called into an emergency, we understand. Please call the help desk or respond to your email with your code and just let us know. There's no problem letting a Capitol Hill office know that a roster's changed or a meeting has to be canceled. There can be a big problem if nobody shows up. So thank you so much for asking that, Caren, and we appreciate your cooperation in terms of keeping us in the loop on Wednesday with what your schedule looks like.
Awesome. Let's do those breakout sessions.
All right, so we're going to start moving to our practice rooms. Again, it's soapboxconsulting.com if you're waiting for your code. Otherwise, you're going to go to sboxmobile.com, put in your code, get to that green schedule icon, press that and look for the giant orange box. And then you're going to press that and see who else from your state delegation is here. You will have to leave this room, so it won't hurt our feelings. We'll see you drift away. We'll be here. If you have questions later, you can pop back or reach out to your MHA staff, and we can answer those questions a little bit later. So thank you. We appreciate it. Start moving to your practice room now.